video, we will solve case study questions by using elimination method. If you want to study musculoskeletal system, guidelines and solve some more questions, check my playlist CPT Musculoskeletal 20,000 series CPC exam prep. Click the link above and I'll also mention the link in the description. Elimination method is very essential for solving big case study questions quickly. In this video, let us solve some case study questions. Let's begin. In this question, first let us check what procedure they have done. They have done open reduction, internal fixation of right scaphoid fracture. Now, directly let us start looking at the options. Option A, 25628. 25628 is for open treatment of carpal scaphoid fracture, includes internal fixation when performed. It is matching with the procedure, that is open reduction, internal fixation of right scaphoid fracture. We'll keep this option for now. Let us try to eliminate other options. Let us look at option B, 25624. That is for closed treatment of carpal scaphoid fracture. So, we'll eliminate option B because in our operative report they have mentioned open reduction, internal fixation, which is open treatment, right? So, option B is for closed treatment. We'll eliminate the option B. Let us look at option C, 25645, that is for open treatment of carpal bone fracture other than carpal scaphoid fracture, right? But in our case, it is open treatment of carpal scaphoid bone only, scaphoid fracture, right? So, it cannot be other than carpal scaphoid, which is in code 25645. So, we'll eliminate the option C. Coming to option D, 25651, that is for percutaneous skeletal fixation of ulnar styloid fracture. That is also wrong. Our right answer is option A, 25628. That is open reduction, internal fixation of carpal scaphoid fracture, includes internal fixation. So the main thing you have to look for in case study questions is type of procedure done and try to eliminate options by looking at the options directly. I hope you're clear with it. Let us move on to the next case study question. Don't forget to like, share and subscribe to my channel. This is a big case study question. So first, let us look at the option 29882. Option A, first code. That is for arthroscopy knee surgical with meniscus repair medial or lateral. So let us look at the main terms in the question, what they have mentioned. Check the procedure. They have mentioned left knee arthroscopic repair of lateral meniscus. So that is matching with our code 29882, right? Now let us look at first code of option B, 29866. 29866 is for arthroscopy knee surgical osteochondral autograft, includes harvesting of autograft. You can check in the operative report if they have mentioned autograft. So option 29866 is for arthroscopy knee surgical osteochondral autograft. In our case, anyway, they have not mentioned osteochondral autograft, right? So we'll eliminate the option B. Coming to option C, 29870. That is for arthroscopic knee diagnostic. But in our case, this is a surgical procedure. It is not diagnostic. So we'll eliminate option C. Coming to option D, 29882, we already checked. So now we are left with option A and option D, 29882. Next code of option A is 29877 with 52 modifier. 29877 is for debridement. Right, in our case, they have performed debridement. Here they have mentioned lateral meniscus where the tear was debrided. Right. So they have mentioned an extra code 29877 for debridement. But please remember that the code 29882 already has debridement included in it. You don't have to code debridement separately. So in your CPT book, in front of code 29882, you can write it includes debridement. So our option E will be wrong. So our right answer here is option D, 29882. In option A, they have mentioned also 29870. 29870 is for diagnostic procedure. So we cannot code that. By that also we can eliminate the option A. We are left with option D, which is our right answer. Let us move on to the next case study. So here procedure what they have done, arthroscopy with subacromial decompression and AC resection left shoulder. So let us look at option A, 29824. 29824 is for arthroscopy, shoulder, surgical with distal claviculectomy including distal articular surface. In the question you can find they have mentioned we took off about 2 cm of distal clavicle because there was a large subchondral cyst. So what they have done? Claviculectomy, right? So you can see the first code of option B, 29825 is for lysis and resection of adhesions, right? That is not mentioned in our question anywhere. So by this we'll eliminate the option B. Coming to option C, 23120. 23120 is for claviculectomy partial. This code is only for claviculectomy. It is not for arthroscopic procedure. You can see below claviculectomy partial 23120 code they have mentioned. For arthroscopic procedure use 29824. In our case it is an arthroscopic procedure. So by this we can eliminate the option C. Coming to option D, 29824. We already checked that code. It is matching with the procedure. Now let us check the second code of option A and option D, 29826 and 29825. What is 29826? 29826 is for decompression of subacromial space. So see in our procedure they have mentioned subacromial decompression, right? So this will be our right code. So our right answer is option A. We'll eliminate option D because they have mentioned 29825 which is for lysis and dissection of adhesions. We already discussed this while checking option B that in our case they have not done lysis and dissection of adhesions anywhere. So by this we'll eliminate the option D. We are left with option A which is our right answer. Let us move on to the next case study question. This is a big case study question. So first let us look at the procedure. They have done operative procedure, you can check. They have done reduction with application external fixator left wrist fracture. Okay. Now let us check the option A, 25600. That is for closed treatment of distal radial fracture. Includes closed treatment of fracture of ulnar styloid when performed without manipulation. We'll keep this for now. Let us check option B, 25605. 25605 is for closed treatment of distal radial fracture, that is matching with manipulation. So let us check in the question anywhere they have mentioned manipulation. You can see here they have mentioned today in surgery fracture was reduced anatomically and an external fixator was applied. In procedure they have done general anesthesia, the fracture was manipulated. Main term we were looking for is manipulation. So manipulation is done in this case. So by this we can eliminate the option A, 25600, that is for without manipulation. Option C, 25606 is for percutaneous skeletal fixation. In our case they have not done percutaneous skeletal fixation. So by this we'll eliminate the option C. Coming to option D, 25607, that is for open treatment with internal fixation. But in our case, they have not mentioned open treatment of the fracture. They have made small incision. But by taking small incisions, we cannot code open treatment directly. To code open treatment, they have to mention that the site is opened surgically to expose the fracture. And they should have direct visualization of the fracture site to code for open treatment. So we cannot code open treatment. So we'll eliminate the option D. We are left with option B, which is our right answer. You can check the code 25605, that is for closed treatment of distal radial fracture. For example, Coles or Smith type. Coles also they have mentioned, right, in our case. And also it is with manipulation. Code 20690 is for application of uniplane pins or wires. In our case, they have put proximal pins. They have mentioned pins also, right? So we can go 20690. Our right answer is option B. Let us move on to the next case study question. Let us check what they have done in the procedure. Diagnostic operative arthroscopy, partial medial meniscectomy and synovectomy, right knee. Now let us start looking at the options. In options, you can see many codes, right? So first, let us start by looking first code of each option. Let us look at option A, 29880. 29880 is for arthroscopy, knee with meniscectomy, medial and lateral. Okay, but in our question, they have mentioned only medial. While discussing the guidelines, I already mentioned that to code 29880, in the case, there must be both medial and lateral present. But in our case, only medial is present. So, we cannot code 29880. By this, we'll eliminate the option A, 29880. In option D also 29880 is mentioned. We'll eliminate that also. If one code is wrong, the entire option will be wrong. Now we are left with option B and option C. Let us check the code 29881. That is correct. That is for arthroscopy with meniscectomy, medial or lateral. So to code 29881, you must have medial or lateral. Any one is enough. So in our case, medial is present, right? So 29881 is correct. Let us check the next code in option C, 29882. 29882 is with meniscus repair. So in this case, you have to find whether they have done meniscus repair. So here you can see they have mentioned the meniscus was then further contoured and balanced with an intra-articular shaver, reprobed and found to be stable. So by this you can find out that they have done meniscus repair also, right? So by this we have to code 29881 with 29882. So our right answer will be option C. In option B, meniscus repair is not mentioned. So I am eliminating option B. Our right answer is option C. You can also eliminate these options by looking at ICD codes, but here there are many ICD codes mentioned, right? So I choose CPT codes to eliminate the options. So that's it for today. If you have any doubt regarding CPC exam questions or guidelines, you can mail me or you can comment below.